I'm Dr. Dawn Barlow. I am the president of the Upper Cumberland Medical Society. I'm an internal medicine physician in Livingston. And I want to take a moment to encourage everyone in the community to wear a mask and to social distance and to make sure you're using proper hygiene. We are seeing an uptick in the number of COVID cases in the Upper Cumberland. We're also seeing an uptick in the number of people who are sick enough to require hospitalizations. And we're seeing our friends, families, family members, neighbors continue to get very sick and die with this disease. We need everyone on board participating with masking, social distancing, and it's so important that every person in the community do their part so that we can get a hold of this infection and get it under control. We are also encouraging, when the vaccine is available, that everyone participate and get vaccinated when the time comes.
Certainly healthcare personnel are not immune. We've had several members, several rural physicians in the Upper Cumberland and a little wider area succumb to this. Dr. Staten, with whom I work closely, he's struggling. He's had all the treatment there is. I mean, the whatever's recommended that's out there has been available in our region, which is wonderful. And he has had that treatment, but he is still struggling, still on oxygen, and we don't know what the outcome is going to be. We know that 80% of people roughly who contract this virus will be fine. They'll essentially shake it off, as some of my patients say. But 1 in 5, 20% of people don't. And of those 20%, about a quarter of them are going to get severely ill and be hospitalized. And that is where the problem lies. And we can't predict who.
Please wear your mask now. This is the perfect time. If you've not been wearing a mask, get it out. Get a N95 mask if you can. Get a double cotton mask if you can. Get the best mask you can to fit your face. Protect your neighbors, protect your loved ones, protect your children, because you don't know in 10 years if your child gets COVID-19 today, whether they're going to have pulmonary fibrosis in 10 or 20 years or not, especially if they pick up smoking or vaping. We don't know the long-term outcomes to our kids. So love your children, love your neighbors, love your family, and love your nation. This is real. So it's our nation at stake. This is the United States of America. There's nothing we can't do if we do it right and we do it together. Unfortunately, not only did I contract COVID-19, but I also contracted type B flu as well. I've had excruciating pain. It feels like someone has about an 8-inch leather belt wrapped around my chest, and I'm in a torture chamber, and they're tightening it as tight as they can possibly tighten it. You know, people want to live a normal life. Okay, living a normal life right now is wearing a mask. And if you're not willing to wear a mask, then stay home. We have to move forward on this disease. If we don't, we're going to achieve numbers of deaths through not being vaccinated that are insurmountable for families. This is serious. This is killing people. It's wearing me out, fellas. We're about there. We got it. I can do it. We got it, man. We need to refocus on a proactive plan rapidly as possible to mitigate the spread of this virus. We need to, as Americans, focus on mask wearing, social distancing. Do not go to Christmas dinner, please. We have Zoom. We have all kinds of opportunities to do it. If you're going to do it, you need to do it in a social distance manner. We have to take these efforts now. Let's protect one another and take care of your health. As we know, suicide rates, drug use, alcohol use, domestic violence, child abuse. All of these things are on the rise during this very stressful time. Please refocus on unity of our nation. Please refocus on caring about your neighbor. If you're not worried about other individuals in your community, at least be selfish and take care of yourself. Because by retrospect, if you do that, then you're taking care of everyone else.
This is just not really rocket science. Face masks, just very simple face masks. Studies have shown that we can reduce the rate of infection by 80% if we just had universal masks, if people would just cover their face, their nose, and their mouth. The reason why is because this is an airborne virus, and that's the way it's mainly spread.
The message that we're all saying is please, please, everybody, wear a mask when you're out in public with people that don't live in your household. Set an example for everybody. Limit your holiday gatherings to people that live in your household. And we need to ask everybody to do this, please, because we need our healthcare providers. We need people like Dr. Staten. We need all of those ICU beds to be available for when there's auto accidents or other things that we have short needs for ICU beds.
Prevention is simple. Treatment is complex. But the real complexity here is attitudes. America is doing the worst of all nations in the world. And if you look at one characteristic of America, if you ask anybody in this country, what is a characteristic of America, one defining characteristic, the answer is one word. It's freedom. We want our freedom. We want to be able to do what we want to do when we want to do it. Well, there was a notable scholar and speaker by the name of Os Guinness. He asked the question, does anybody know what the number one enemy of freedom is? And the answer is freedom. And this pandemic is proving it. We are currently our own worst enemy because instead of protecting and loving one another, we are wanting our own freedom to do what we want to do when we want to do it. So I'll come back to the message that we've all stated. Prevention is simple. Please wear a mask.
I think what it comes down to, as an American nation, we need to refocus on unity